loves, welcome back to my channel. My name is Oyinka, and if it's your first time stopping by, you darling, I'm most definitely welcome. So in today's video, I'm going to be talking about the types of vaginal discharge. Is your vaginal discharge healthy? Is it not healthy? Do you need to step up your feminine hygiene? Do you need to see your doctor? Should you be worried? So many questions that I'm going to be answering in this video. This topic, I feel, is something that's very hush-hush. No one really wants to talk about it, but you know I'm a doctor. There's really nothing that we as doctors haven't seen, so I promise you this is really not a big deal. If that sounds like something that you'd be interested in, please keep on watching. Now, a few months ago, I put up a poll on my community tab asking my subscribers if they would like health talks here and there, and they were really excited about that, which is why I decided to bring this video to you. And I've actually made a video similar to this in the past, and I'm going to link it up in the card. That one was just like really broad. We talked about a lot of things ranging from contraceptive use to feminine hygiene, vaginal discharge. We talked about a lot of things really. So if you haven't checked out that video, I would definitely encourage you to click the card or check down in the description box. I'm going to link it down in the description box so that you can check it out. All right, now let's jump right into the meat of today. Please don't forget to give this video a big thumbs up if you enjoy it. Hit that subscribe button down below to join this family, and share this video with everyone who cares to watch it, literally. And without further ado, let's jump right into the video. Of course, you're going to want to know what is vaginal discharge, and like the name implies, really, it is literally a discharge from the vagina. Very simple, very straight to the point, no complications. I'm going to try to make this as simple as possible because I know that a lot of age ranges are going to be watching me, from young to middle age to old, and I want to make sure that everyone across all ages can understand what I'm trying to say. So I'm going to try to avoid medical jargons as much as possible so that you and I are literally on the same page. Vaginal discharge literally tells you a lot about your body. Depending on the color of the discharge, the quantity of the discharge, the smell of the discharge, it can tell you whether your female area is good or if it needs some special attention. So the first discharge that we're going to be talking about is a yellowish greenish vaginal discharge. Now, anytime I hear that someone has a yellowish or greenish vaginal discharge, automatically thinking that this person could very well have a sexually transmitted infection. And the first one that comes to my mind is something that we call trichomonasis. Now, trichomonasis is more often than not sexually transmitted. Apart from the vaginal discharge, the person may also complain that it has a musty odor, and that there is an associated vaginal itching, and that there is also like pain around the area, pain when the person is trying to have sexual intercourse, and all of that. Not to worry, this can be treated with antibiotic use, so you should definitely go to your doctor who would confirm the diagnosis using simple investigation that can be done in the clinic and give you antibiotics to treat this infection. Bear in mind that if you don't treat trichomonasis well, it can lead to further complications such as salpingitis, tubo-ovarian abscess, and it can also cause pelvic inflammatory disease. Now, salpingitis is just a big term for saying that the fallopian tubes are inflamed. Tubo-ovarian abscess means that there is like a collection of like purulent fluid, and all of that can just be application of something as simple as trichomonasis that could have been treated with antibiotic use. So guys, I feel like I oversimplified the whole salpingitis and tubo-ovarian abscess, and I wanted to stress that it can actually be a very big deal. Salpingitis on one hand can go ahead to cause infertility in the future, and I know that many women will not be happy with the diagnosis of infertility, especially if they are hoping to have children in the future. While tubo-ovarian abscess can be a potentially life-threatening issue, especially if that pus collection spills and goes ahead to cause something that we refer to as sepsis, which is a very severe infection. So if you don't know that you have trichomonasis and then you go ahead to have unprotected sex with other people, you can spread this infection. Unlike in women, trichomonasis is usually not that symptomatic in men. They usually have mild symptoms, but yeah, we're talking about women, so we're going to focus on the presentation in women. Remember, if you notice a greenish, yellowish vaginal discharge that is frothy or foul smelling with an associated itching around your vagina or pain when you're having sex, then you definitely need to see your doctor. Now, the next color of vaginal discharge that we're going to be talking about is whitish vaginal discharge. Now, when someone says that they have whitish vaginal discharge, then go ahead to ask them, is it more than your normal vaginal discharge is? If the person says yes, now the first thing that my mind goes to is yeast infection. And the medical name for yeast infection is candidiasis. So if someone says, oh, I have itching around my vagina, I noticed a whitish curdled discharge, that is the first thing that comes to my mind. I should say candidiasis isn't a sexually transmitted infection. It can happen in younger women, middle-aged women, older women, doesn't really matter. It can happen in women of all ages, but it's usually common from teenage years upwards. The organism that causes the infection resides in the vagina normally, but sometimes the organism can start to over proliferate, and this usually happens maybe after a course of antibiotic therapy, or if your immunity is down, or maybe in pregnancy. Some women don't have symptoms except you look into their vagina during an examination. They may not complain of itching. Other women definitely have redness, itching, and a whitish clumpish vaginal discharge. This discharge is characteristically described as a cottage cheese appearance. You cannot miss it. It's usually very easy for even people who are not medically inclined to be able to spot the diagnosis when they see it. Now, this can be treated in a couple of ways. You can either use tablets or you can use a pessary. Now, you want to be careful about which is for which so that you don't end up swallowing a vaginal pessary in place of an oral tablet. The next discharge we're going to be talking about is reddish pinkish discharge. Now, this can happen depending on what phase of your cycle you are in. When someone tells me that they have a reddish or pinkish discharge, I'm thinking, okay, what phase of their menstrual cycle are they? Right before your period begins, you may notice that your discharge is a bit pinkish and that you're like, I'm about to have my period. And this usually has like a metallic smell to it. You know the smell of blood? Something like that. Then you know that, oh, my period is about to come. If you notice this discharge after your period, it's usually brownish instead of pinkish because the blood has oxidized in your vagina, because the transit time is a bit longer after your period. So you notice a brownish vaginal discharge. That also would be considered as normal. So a pinkish vaginal discharge right before your period starts and a brownish vaginal discharge right after your period ends would both be considered as normal vaginal discharge. Now, when it starts to get a bit tricky is when you start to notice this pinkish vaginal discharge in the middle of your cycle. So let's say you already had your period and it's not time for another period, but you're noticing a pinkish vaginal discharge right in the middle of your cycle. We would usually call this an intramenstrual bleed. So you definitely want to take note of that and go and see your doctor, because it can definitely raise eyebrow and you want to make sure that you pay attention to that. When you're a bit older, like postmenopausal, and you notice pinkish reddish vaginal discharge, that just sends a red flag in my brain, because I'm thinking older women who are already menopausal shouldn't be having that color of discharge. It then goes ahead to tell me that this person may be having an endometrial cancer. So you definitely want to take note of that, and you definitely want to go and see your doctor about that. Another time that it may be considered normal, depending on the context, depending on if you want it or not, is early pregnancy. This is what we would call implantation bleed. So you would normally be expecting your period around that time. Let's say it's already time for your period, and then you notice a pinkish or reddish vaginal discharge and you think it's your period, but it only lasts like 1 day or so. Then you know that I don't think this is my period. It might just be an implantation bleed. And it's usually smaller quantity than what your regular period would be. It's usually of a very short duration. Why is this happening? Why is an implantation bleed happening? When there's a fertilized egg, the egg needs to implant itself into the endometrial wall. So in the process of implanting itself into the endometrial wall, it can burrow itself in and cause some bleeding, which would come out as implantation bleeding. Another time that this vaginal discharge is not considered normal is if you are already pregnant and you are experiencing reddish discharge from your vagina. You know that that is something called spotting. It can be a sign that maybe a miscarriage is about to happen. So you definitely want to take it seriously and go and see your doctor. I hope that this is very simple, and I hope that we are on the same page. Now, the next color of vaginal discharge that we're going to be talking about is a grayish vaginal discharge. Anytime that I see a grayish vaginal discharge, I'm thinking this could be a bacterial vaginosis. Now, bacterial vaginosis, should say, is not a sexually transmitted infection, but it is associated with women who have sex, right? There will be an increase in quantity of the vaginal discharge, and it will be fishy, foul smelling. The affected individual may also complain of vulvar itching, which is the lips of the vagina would be like really itchy and swollen, and the person may also complain of pain during sex. This is something that you definitely want to take note of, and it can be treated with antibiotics, really. Now, I want to talk about clear vaginal discharge. That is what we would normally refer to as a normal vaginal discharge. This clear vaginal discharge can vary in texture, can also vary in quantity. It can be liquidy, it can be more like stringy, and that can just tell you at what phase of your cycle that you are in. Usually it would have no smell or might just have a slight smell. That is something that we would consider as a normal vaginal discharge. Now, I wanted to say the things that you can do to improve your overall feminine hygiene are: don't douche. Don't douche. I know that a lot of people stick up a lot of feminine hygiene products into their vagina and in a bid to try to wash everything, but you literally want to avoid doing that. The vagina is self-cleaning. It cleans itself, and it doesn't need your help, honey. It does not need your help to clean itself. So what you want to do is avoid sticking anything into the vagina. If you feel like you want to wash your vagina, just use mild unscented soap to wash your vagina. On the outside, avoid sticking anything into the vagina. Another thing that you want to do is practice safe sex, really. By safe sex, I don't mean contraceptives. I mean either sticking to one partner or using a condom if you want to have multiple partners. So you want to definitely practice safe sex so that sexually transmitted infections are not transmitted to you in the process of having sex. When you want to see your doctor is if you begin to notice bleeding, like we spoke about earlier, if you notice abdominal cramps, which could be a complication of trichomonasis, like we spoke about earlier, which would have progressed to like pelvic inflammatory disease if you did not take care of it properly. You definitely want to see your doctor if you start having lower abdominal cramps. And then you also want to see your doctor if you notice that you have a fever. Hope that this has demystified vaginal discharge for you. I hope that you and I are literally on the same page as regards vaginal discharge, and I hope you feel enlightened and that you know everything that there is to know about vaginal discharge. If you enjoyed this video, please don't forget to give it a big thumbs up and share it with everyone who cares to watch it. And yeah, thank you guys so much for watching, and I'll catch you guys in my next video. Bye guys.